Dr. Batra, did you come up with a so-called working or preliminary diagnosis?
Well, so this is a challenging case because there is a preliminary possible diagnosis that could fit this set of symptoms. It's something called Morgellons disease, and that's a controversial diagnosis. It actually has sort of a combination of the physical findings that Aidan was mentioning in terms of seeing filaments, of having the sensation of maybe bugs or parasites in your skin. And then there's often also a psychiatric component to it in terms of the way those sensations may be perceived. And it's a challenging diagnosis. I would call this very preliminary because, as I mentioned, there were some test results that are still pending, but the sensations that he was describing, the prior filaments, the photos he had shown me, he was kind enough to show me videos and photos. And the other really interesting thing was he's so meticulous, it was wonderful. He brought in specimens of prior extrusions. So again, I didn't run a PCR test or stain them, but I did look at those specimens on glass slides in a microscope in my office. And I couldn't overtly see anything that looked like an infection there. Those looked like normal filaments or kind of fibers from clothes or from dead skin cells. So it's a challenging one. I would say the preliminary diagnosis in my mind may be this idea of Morgellons disease, but there are some unknowns about this. This is incredibly rare. There are only 14,000 cases of Morgellons described to date. The CDC doesn't recognize it as a recognized disease. There have been studies at the University of Oklahoma, and they're trying to catalog the symptoms to get a better sense of what this entails. And so sometimes, Aiden, unfortunately, what happens, especially with something like this that we don't fully understand, that's not well recognized, that's sort of in a preliminary stage, is that people find themselves or find each other online, and they're searching out support groups. And there's certainly doctors who don't believe this condition exists. There are others who certainly emphatically think it exists and have tied it to Lyme disease and symptoms of that. But we don't really know. And so there's still some unanswered questions. But I do think that the one constant that does fit your symptoms is that I don't doubt that you're having these physical symptoms. And then there may be a sort of psychiatric component as well as to how you're interpreting the symptoms.
Well, and that's the key. And Dr. Batra, interestingly enough, we did talk about Morgellons 14 years ago on the show. That was season 1. We had a 40-year-old woman with very similar constellation of findings, skin lesions, picking filaments out of her skin. And what I can say that over 14 years, not much has changed in the medical community. It's still a mystery disease. There's still a big debate whether it's a true disease process or not. Clearly, it's an interface of the mind-body connection, physical manifestations with potential underlying psychological issues. So to that end, Dr. Batra, can this be treated?
So it's interesting, to your point, this has actually been described for hundreds of years with a very consistent set of symptoms. It was first mentioned by Sir Thomas Browne, who was a British physician studying French school children in the 1600s. Much more recently been resurrected in about 2002 when a mom tried to found a research consortium for her son. And the way over years this has been treated is with antipsychotic medications for Tourette's, some medications for Lyme disease, but these are all limited and they're case series. So to your point, it is right there at that interface of the physical and the psychiatric. And so there's no established protocol for treating this.